Live from the Fox 29 studios, this is Good Day Philadelphia.
On the river. Okay, I want to get rid, every now and then, at certain angles, I do have a little double chin. But I'm afraid of surgery around my neck.
Well, there's a new thing that you can do to help with that, right?
I'm all ears.
So Jen's going to show us.
I'm all chins.
Hey guys, okay, so we're here with Dr. Jason Bloom again. Good morning.
Good morning, Jen.
And this thing was like wildfire on the news last week, right? So what is the name of this new treatment?
All right, so this is an injectable treatment. It's called Kybella. It's by a company called Kybella. And what it is, it's an injection of deoxycholate or deoxycholic acid. What that is, it's a bile acid to dissolve fat underneath your chin.
Okay, so we have some before and afters that we're going to show on the screen.
Right.
And the pros are no surgery, not a lot of complications, I'm assuming?
No, most of the issues regarding the product were just related to actually the site injections. Things that you would think of if you're getting an injection there, bruising, some swelling, possibly even some numbness. But the results are real. It is really, really going to be a game changer for some practices.
In the fast food world that we live in, though, in America, like this is not a thing where you go and you do the injection and ba-bam, you have a better look.
Right.
Okay.
This is something that occurs over a series of months.
Okay.
The injections are actually spread out somewhere between like about every month, and depending on how much you need, you can get up to 6 injections. But most of the patients in their clinical trials, they had 20 different clinical trials, got about 3 to 4 injections.
And to be clear, we can't get it right now. You have to wait till like June, July to get it?
Right. So they're having a meeting in June, and they're taking the trainers down to actually learn about the product.
Okay.
The company is actually doing this really right. So not everyone is going to be able to just get this. You need to be trained by one of the trainers. It's actually me in the Philadelphia area.
Okay.
But before you can even purchase the product.
So we can't go to a Medi-Spa. This is not going to be something that, because the company wants it in the best hands.
Absolutely.
Okay, so, but it's not like everyone that has something under there can get it. You said we need to be looking at we have to look in the mirror a little bit.
Right, this is really a product that's going to come down a lot to patient selection. That's also why the practitioner that's going to be injecting it, it's important to evaluate the patients prior to doing the injections.
So if you're fat in there, it's going to work. If you're just loose, it doesn't work.
Exactly. So really, it's not going to really tighten the skin, but it does dissolve the fat. So the neck ages in actually 3 ways. You get fat deposits under the neck, you can get loose muscle and loose skin. Now, if you dissolve some of the fat, we use different treatments to try to tighten the neck, whether it's non-invasive things through lasers or energy-based devices, micro-invasive things, or even surgery.
Okay, last thing, because we're wrapping it up. Can you stab it in my tummy?
Well, right now, no.
Okay, well then that's it. All right, sorry. Hi, I love Dr. Bloom, but if you can't stab it in my tummy and get, not that I would, but I wouldn't.
Well, yeah, you're...
I mean, I'm just...
Please,
yeah. But I wouldn't.
You don't need it.
Yeah, no.
I'll tell you, that dude right there standing next to you, though. Okay, cool. That dude standing right next to you, he can freeze the fat off of your stomach,
He can
though.
freeze the fat.
That's right. It goes out in your poo.
Works well.
That's right.
He just wanted an excuse to say that.
What, poo?
Yeah.
Oh. Okay, what are you doing next hour?
People have red on their neck and they don't know what it is, and so Dr. Bernstein's going to come and wow us with some. It's like a weird thing that happens, and it's over. I'm not sure. I'm not a doctor.
I know.
Sun damage.
There you go.
But he is, thank God.
He is.
All right, 7:52. Did you hear about the swan in South Jersey?
Yeah.
Some creep poured a chemical on its head.